Good evening, everybody. Welcome to the webinar. My name is Alex Wilson. Tonight, we're going to be talking about dealing with patients in distress. And this webinar tonight, excuse me, is really aimed at GPs and other medical professionals, particularly those of you that might have limited time with your patients, have a very busy schedule, and sometimes come across patients who are very distressed, and you need a really effective, compassionate way to help them de-escalate, so that you can solve the problem and move on to the next thing, but also send them out the door feeling much better. So I'll get into our content. Let me share my slides with you and I'll tell you a little bit more about me if you don't know me already. Let me find my slides here. Okay, there we go. All right, and I'll just put this in present mode. So we have a nice big screen. Okie dokie. So tonight I'm going to talk about a few different areas. I'll give you a little intro about me and my practice, and then we're going to talk about all of the following things: how to understand distress, some brain stuff that's really important, and something called tip skills. And these are skills that me and my team use in our practice every day with our mental health clients. We'll talk about some really common issues that may come up for you, and then you can ask questions if you like, if you're here live. Okay, so this is me. So my name's Alex Wilson. I'm an accredited mental health social worker, and I'm the director of Mindful Recovery Services and the Central Coast DBT Centre. We're in Erina on the Central Coast. This is a picture of my team here. Social workers and counsellors are all very experienced. There's Liz and Jen, me, and then Erin, all very experienced in mental health treatment and presentations over the public and the private sectors. So I've had 21 plus years in mental health, and I worked in the public sector to start with, and I've been in Mindful Recovery Services and running that practice for the last 14 years. And Mindful Recovery Services and the Central Coast DBT Centre, we specialise in mental health treatment for complex mental health conditions. So things like borderline personality disorder, complex PTSD. We specialise in chronic suicidality and self-harm. Those clients who, often really struggle to regulate themselves and have lots of times of crises, they are the people we love to work with. So we provide one-on-one therapy. We also do groups and different types of DBT programs. If you've heard of DBT, it stands for dialectical behavioral therapy. And the skills that I'm going to share with you tonight come straight from DBT. So we run a bunch of groups and other programs, as well as doing one-on-one counselling sessions for teens and adults. So we see anybody aged 13 and over. So if you want to get in touch with me after this webinar and let me know where you're at and what you do for a living and how these skills might help for you, please do. I'll give you some resources at the end where you can get in touch. Okay, so why do we want to learn about distress, right? Why is this an important topic to even know how to help our patients in distress? So recent statistics show that around about 50% of GP visits are mental health related. So we know for our GPs, mental health is really part of their bread and butter work. And this is the same in a lot of health settings. I know, having worked in hospitals, in hospital medical departments, there's lots of mental health stuff going on, emergency departments, places like that. Lots and lots of mental health, because mental health overlaps with physical health and lots of other issues as well. So GPs and other health professionals often have limited time, often very busy schedules. I think most healthcare providers are very busy, and often, deal with unpredictable presentations. So you never quite know day to day what might walk through the door. I know it was like that when I, worked in a hospital setting. So knowing ways to help de-escalate your patients helps patients, right? Because it teaches them new skills that they don't already know to help them de-escalate, not just when they're there with us, but also when they go home, right? So these are really transferable skills that they can put in their toolkit and can help them in their day-to-day, which is great. So these skills work fast, and they're designed to be able to be used in times of any kind of emotional overwhelm. So let's think a little bit more about distress. I'm going to introduce you to this DBT concept, so this dialectical behavioral therapy concept called the distress curve. And this is how I like to describe how distress works. So patients can understand it, so families can understand it, so health professionals can understand it. So distress goes in waves, right? Like any emotions, goes up, reaches a peak, comes back down. Given enough time, distress will always pass and change. Same with joy, right? Emotions never stick around forever. Some of our patients might feel like they're stuck in distress when they're in it, but we know feelings don't last forever. They come and they go. In our clinic, we like to rate distress out of 5. So 5 out of 5 is like full meltdown mode. And that 5 out of 5, really is when people start to feel overwhelmed. And, it could be a panic attack at the top of the curve, or it could be, just feeling totally overwhelmed with whatever emotion might be there. And so the difficult part of this curve is really the top of this curve. So thinking about when we hit about a 4 out of 5 on our distress scale, that's when we're really going to struggle to regulate ourselves. So when we're dealing with patients in a clinical setting, for whatever reason, they may come in already at a 4 or a 5 on their distress scale, or something might happen in our consultation or in our discussion and interaction with them that gets them up around this 4 or this 5 range of their distress curve. And I'm going to talk about the brain in a minute, because up at the top of this distress curve is where we're going to teach some skills to help people regulate their body chemistry. But it's really important to understand it's the top of this distress curve that's really the most tricky part, right? When people are down below a 4, they still might be agitated or distressed, but they're able to think and have a conversation and work their way through it. But when people are at 4s and 5s, that is our overwhelm point, and they might really need us to help them come back down the other side of that curve. Now, some people's moods go like this, right? Some of us have, our moods go up and down. Other people, they have these very erratic ups and downs of mood. We sometimes call it highly changeable, labile mood. We might say this is impulsive or erratic. Some people, this is their normal kind of mood. Certainly with something like borderline personality disorder, we might see this kind of really up and down mood. Or people that go 0 to 5 really, really quickly. Or for some people, this might be what they look like when they're in a crisis time. Maybe they're dealing with grief or loss or a health issue or something else that's triggered them, and they're kind of going up and down really quickly. Some other people, their distress might go like this. They go up, they reach a point, and they stay quite distressed for a while, and it takes them a longer time to come back down the other side. We call that a slow return to baseline. Again, we see this with people very commonly with trauma histories. A brain that's experienced past trauma will often stay quite elevated for some time before it can settle down. But again, people, dealing with different things in their life might experience this slow return to baseline. Whatever the pattern is for the patient in front of us, it actually doesn't matter, because the skills that we're going to teach them are going to work for them when they're up the top of their distress curve. If they're up there for an hour, or if they're up there for 1 minute, these skills are still going to help them. Okay, but just keep that in mind. You might see different patterns of this. So what are the signs we might see in a patient who is overwhelmed? Okay, so the patient might say things like, I can't think straight, okay? that really indicates that something's going on in their nervous system and in their brain that we're gonna touch on in a minute, where they really just can't kind of get their rational mind online. So they might say, I can't think straight. They might be in the midst of a panic or an anxiety attack, right? That tells us that they are at the top of their distress curve. The patient might be unable to communicate clearly. So they're otherwise healthy. So there's no other physical health conditions that would account for this, but they're really struggling just to speak to us. That might indicate that the patient is in overwhelm at the top of their curve. They might be angry or yelling. So that can be a sign that somebody is overwhelmed. They might be sobbing or crying uncontrollably. We'll probably notice that. They also might be talking about self-harm or suicide. That is obviously a key feature of somebody who is in overwhelm. Okay, so we're going to watch out for these things. And if we see these things, then we can apply the skills that I'm going to teach you tonight. So let's talk about the brain, and I'm sure I'm preaching to the converted here, but I'm going to give you just the real layman's rundown of how I explain this to patients so they understand. And I like to talk about the advanced brain and the primitive brain. And you might use different language when you have this discussion with patients, but sometimes I'll actually draw a picture of the brain and talk them through it. But so we understand what's happening when people are on their distress curve. At the top of that distress curve, when they're hitting their 4s and 5s out of 5, when they're hitting overwhelm, what's happening in their brain is that their amygdala, the threat detector, right, their fight, flight, freeze response, that is being activated, okay? The brain is thinking there is a threat, something bad is happening, and it's starting to pump, adrenaline and cortisol, all these sorts of things around the body, as if there's a lion coming at us, right? What happens when our patients get activated in this amygdala is that their frontal lobe, right, which is all rational thought, emotion regulation skills, that all goes offline, right? We know that the brain does this as a protective mechanism because if a lion's running at me, I don't need to think about weighing up the data and think about whether I should run. I just need to run. So this primitive part of our brain, the amygdala, is always going to override the frontal lobe and the smart brain, just to use basic terms. So what we need to recognize is when we're seeing a patient in overwhelm, and again, it could present in a number of ways. It could be the patient who's sobbing and crying or having a panic attack, but it can also be the patient who is shut down and unable to speak. They might also be in the same kind of overwhelm. And we need to understand this is happening in the brain because so often what people do, and I know this happens a lot in families that I work with, when somebody is in overwhelm, what people tend to do is they try and talk them out of it, right? They try and be reassuring and use lots of words and explain things. The problem with that is that when your patient is in overwhelm, the part of their brain that can process what you're saying is offline, right? Because they are in their fight flight mode. They're at the top of that distress curve. So you could be explaining, things very eloquently. They can't hear you. And so that doesn't de-escalate anything. And what can happen is the patient just feels more and more stuck in this elevated state, or more and more frustrated with themselves that they can't hear and rationalize what's going on. So this brain stuff is, we all know it, but sometimes we don't remember it when we have a distressed patient sitting in front of us and we think, I'll just explain things better and they'll calm down, and then they don't. And this is why, because this is what's happening in their brain. And remember, there are some people who, once that amygdala is triggered for them, it takes them much longer for that to settle down. Again, if we're dealing with anybody with a trauma history, they're going to have a sensitive amygdala that activates really quickly, and it might be very slow to settle down. If you're dealing with somebody who's struggling with anxiety, for example, they might have an amygdala that's just firing all the time. They can't hear what you're saying when they're in that state. Okay, so This isn't a matter of us trying to explain things better or reason with the distressed patient. We actually need to work with the brain chemistry problem here, right? And it's a problem because it means we can't communicate with them, but it's not actually a broken brain. It's just that the brain's been triggered for some reason. So some really important things for us to recognize. When that amygdala is activated, when the threat detector fight flight is activated, frontal lobe and high level thinking is gone, right? It's not accessible. This could be a patient in front of you who is usually highly functioning, but all of their emotion regulation skills are lost to them in this moment. Rational thought has left the building is often what I say, okay? So there's no point appealing to rational thought when your patient is in this state, it's gone. Using words will not help. They cannot hear you. You literally could be speaking another language. That's what it's like. And if you've ever had a panic attack and had somebody try and talk you down from a panic attack, you'll know it doesn't work. It's just noise, right? Because your body's doing all the things it's doing. So what is needed is skills to change body chemistry. And that's what I'm going to teach you. So we do know that with time, the distress will come down on its own, but we can use some skills to speed it up, particularly if we are only with a patient for a short amount of time. Okay, so let's get into our tip skills. Now, these skills, as I mentioned, are from dialectical behavioral therapy, which was developed in the 90s for the treatment of borderline personality disorder, but also, for chronic suicidality and a bunch of other things. Now, DBT is used extensively to treat lots of different emotion regulation issues. But these skills have been studied extensively and shown to be in a number of, quite a lot of research trials, to be super effective at changing body chemistry and that brain thing that we were just talking about. So sometimes we need to function without being overwhelmed by emotions. Sometimes our patients need to function, right? There are some things we need to get done in a consult that just need to get done, and we need to be able to bring them back down. When we're highly triggered, we can't think, right? So remember that. And actually, if we can teach our patients these skills in a session with us or in a consult with us, they can use these skills at home or in other situations when they feel overwhelmed. So we're actually giving them skills to add to their toolbox that are going to be super helpful for them for the rest of their lives. Major bonus. So the skills I'm about to teach you are going to change body chemistry to reduce that high emotional arousal and reduce feelings of overwhelm. These skills work very fast, so within seconds to minutes, to bring down emotional arousal. And the skills are easy. They don't require a lot of thinking. A couple of them require a little bit of practice, but they're very easy things that everybody can do. So when do we want our patients to use these skills? Whenever they're in crisis mode, whenever they're having urges to engage in a problem behavior, whenever they can't distract themselves out of distress, if they need to do something, but they're feeling overwhelmed, or if they're not processing information effectively. These skills will work in all of these scenarios. But an easy way to think about it is when they're in that fight-flight mode, when they're highly activated, these are the skills to use. Okay, so there are 4 skills that I'm going to teach you tonight that make up tip skills, okay? I'm going to go through each one of them, but here's an overview. We're going to start with what we call the dive skill. But as you can see, it's about tipping the temperature of your face with cold water, but it's not just cold water. There's actually a few different elements to make this skill work the best. Then we'll talk about exercise, paced breathing, and muscle relaxation as well. These slides as well, I'll send, there's a Dropbox link that I'll send everybody, so you'll have a copy of these slides if you registered for the webinar too. Okay, first skill. Now this is my favorite because it works super fast, within seconds. It's very easy to use in a clinical context, and it really doesn't involve much skill at all. You just need a few different supplies to make it work. So We're talking here about tipping facial temperature with cold water, but actually what we're going to talk about is inducing the dive reflex. Now, the dive reflex, you may already be aware, is a reflex that all mammals are born with. If we dive into very cold water, what happens in our nervous system is that it deactivates our sympathetic nervous system and it activates our parasympathetic nervous system. So what that means is if I dive into cold water, my heart rate will drop instantly to below my resting heart rate. And it's like hitting a big deactivate button in the nervous system. Everything kind of shuts down and starts just creeping along. The reason it does that is because if I dive into really cold water and my heart's racing and, I'm losing all this heat and needing all this oxygen, that's bad, right? It shuts everything down so I can get to the other side. So it's just this nifty reflex. We all have it. And the idea behind this skill is that if I can trick my body into thinking I'm diving into cold water, it will do this for me. It will drop my heart rate instantly. It will deactivate that amygdala and it will kick in that relaxation response. Now, a few different ways to do this skill. Of course, you can dive into cold water, but that's not practical. The best way to do this skill, there's two ways that I like to teach it. First option is to fill up a sink with cold tap water. Hold your breath, bend over, and put your face just up to your temples in the sink. Now, the guidelines say to hold your breath for 30 to 60 seconds, but really I just say to my patients, hold your breath as long as is comfortable, okay? So the key things with this skill is that the water needs to be cold, not ice cube cold, just tap cold, okay? But it does need to be cold. We need to be holding our breath and we need to be bending over. Okay, so 4 main factors will make this work. It's cold, it has to be wet on our face, holding our breath, and bending over. If I do those 4 things, this will trigger the dive reflex. Okay, so if you use this with a patient, if you have a sink in your clinic, you could, of course, fill up the sink, have them hold their breath, bend over, and place their face into the water for as long as is comfortable. That will trigger the dive reflex and that will switch them straight out of that overwhelm quicker than anything we know of. There's another way to do this if you don't have a sink or a bowl of water. This is what we do in our clinic. We keep some little freezer, those gel freezer packs in the freezer. You can buy them from Kmart for like $2. They've got blue kind of fluid in them. And when we want to use this skill with a patient, we get a flannel, so like a face flannel or a hand towel. We keep lots of those in the clinic. We will run that under cold water. Then we'll take the wet towel, we'll wrap it around the cold pack. We'll get our client to be sitting in their chair. We'll have them put the cold wet pack over their eyes and cheeks. Okay, very important. It has to be over eyes and cheeks. We'll have them hold their breath and bend their head down towards their knees. That will trigger the dive reflex as well. So again, it's cold, it's wet on their face, they're holding their breath, and they're bending over. Those 4 things will get the full reaction here. So we use this skill more than any skill in my clinic. We have like lots of distressed people, obviously, that we see. And this is the go-to. This is the one that always works when somebody's really hit overwhelm and we just need to bring them down a little bit. This skill will work for everybody. It's just a matter of how you set it up. So as you can see, there's a few little things you'd want to have ready to go. So we always have plenty of small towels. We always have our cold packs in the freezer. Sometimes we keep a bowl hanging around, but we just keep these things ready just in case. And our whole team is trained in this skill so that, anybody can help a patient do this if needed. So that's our dive skill. This is the fastest and most powerful one. So if you can do this one with your patient, do this. And then they can, of course, do this at home anytime they need to deactivate that overwhelm. Now, just a note here, if you have a patient with, heart issues, Just make sure, you know, that a drop in heart rate is not going to be problematic for them. It's a very safe skill, but if anybody's got some erratic heart stuff going on, just be mindful because it does drop the heart rate quickly. But other than that, there's really no other issues to be concerned about. And yeah, just thinking about how to set up your clinic so that you have things available to do this skill if you need to. Okay. Skill number 2. Now, this one's not so practical, although we have used this one at my clinic at times. If somebody is able to get their heart rate up for at least 20 minutes, we know that will deactivate that overwhelmed state as well. So when I say heart rate up, we're talking about like a 7 out of 10 exertion level for that patient. Again, we need to be careful how we do this and with who we do it with. The way we do this in my clinic sometimes is we might have somebody will say, okay, you know what, let's do some vigorous push-ups and sit-ups, or let's go for a brisk walk around the block. You know, we sometimes do that with our patients. It depends whether you're set up to do this sort of thing. This will work, but it takes longer. This might be a skill that you tell your patient about that they can use at home. So it might be something that they use outside of the clinic rather than in the clinic, but it's a very effective skill. So 20 minutes of some kind of aerobic exercise, walking, running, stairs, whatever, for 20 minutes will get them to deactivate. So this is one they can take home with them. There's just some really basic ideas there, but that will work, particularly if they're at home and they just leave their running shoes by the door and say, okay, I'm feeling overwhelmed. Off I go for my 20 minutes. And when I come back, I'm able to think straight again. Now, the third skill is paced breathing. Now, this one is, again, very helpful in a clinic setting. It's really important to understand that deep breathing for a highly distressed person will make them feel a lot worse. So what's happening when we are activated in our amygdala is that our body's thinking there's a lion running at us, and it starts to take in more oxygen. Right? So when people hyperventilate, what's happening is that they're sucking in too much oxygen, right? And this is something our body does because if a lion's running, I need to be able to have lots of oxygen to my big muscle groups, and I need to be able to get away. The problem is when there's no lion, I'm getting all this oxygen, but I'm not using it. And so my levels are getting all out of whack, and I'll end up passing out or feeling very dizzy. So sometimes what people do when they have a distressed patient in front of them is they'll get them to do deep breathing into their belly. Worst thing you could possibly do. So instead of that, we're going to ask them to do what's called paced breathing. But the focus of paced breathing is on a long exhalation. Okay, so it's the opposite of deep breathing. So one of the ways we teach it is we might get the patient to inhale for 4 seconds and exhale for 8 seconds. It doesn't actually matter the seconds. What matters most is that the exhale is twice as long as the inhale or more. Okay, so the exhale has to be at least twice as long as the inhale. The reason for this is, number one, the body's already taking in way too much oxygen when they're in fight flight. So we're trying to balance that out by more breathing out. And number two, when we exhale, our heart rate goes down. Inhale, heart rate goes up. Exhale, heart rate goes down. So we're encouraging the heart rate to steady down. Okay, so when I do this with my patients, what you'll notice when the patient is highly agitated or distressed and you try and get them to pace their breathing, they'll really struggle with the out breath. It'll look like this. It'll look like, right? They're really struggling to get that out breath, and that's okay. We're just going to sit with them and we're going to try to just get that out breath a little bit longer next time and a little bit longer next time. What I'll often do is I'll put 1 minute on the clock, or I'll put a little timer and say, for 1 minute, let's just focus on trying to get longer out breaths. Okay, that's all we're going to do. So it doesn't matter too much about the counting. What matters is how long we can get that out breath. This works well with younger children as well. The way we teach young kids to do paced breathing is we get them to blow bubbles through a bubble, like a bubble wand, right? It works with teenagers too. Some of my teenage clients love a bit of bubble breathing, as we call it. It can be a great way to stop a younger child from hyperventilating. So you might want to think about keeping some bubbles in your clinic, keeping them up your sleeve. They can be a little messy, but it might be worth it. That can be a great way to practice. Of course, this is a great skill for a patient to take home with them because it's very portable. They can use this skill anywhere where they are. Now, this skill does take some practice to get really good at it. So if I'm trying it with my patient for the first time, it might feel a bit clunky. We'll get there, but they'll struggle with it. I'll encourage them to practice that skill every day until I see them again, maybe just for 30 seconds or a minute. What I want them to get a real muscle memory of what it's like to do paced breathing, right? I want their body to remember what that long exhale feels like, because then when they hit overwhelm, they'll have that memory rather than trying to get it out of this frontal lobe that's not on. So the first time I do it, I'm going to have to really guide them through it, but then I'm going to encourage them to practice on their own so that it becomes a go-to skill for them in the rest of their lives. So a lot of my clients really love this skill, even if they've had bad experiences with breathing exercises before. Again, this is not like those other breathing exercises. It's not about deep breathing. It's the opposite of that. And the final tip skill is what we call paired muscle relaxation, but the name is a bit deceptive. This is actually a tense and release exercise. Now, a lot of patients might have done muscle relaxation where, there's those exercises you can get where they're guided and they say, start at your toes and tense up your toes and release, and then move up through your feet and your ankles and your calves, etc. That is one way to do paired muscle relaxation. But in a crisis situation, in overwhelm, there's a better way to do it. And that better way is to get the patient to identify one set of paired muscles. And we're just going to focus on long tensing and full releasing, again, for about a minute or so. So what I mean by paired muscles is that they need to be the same muscles on both sides of the body to make this work. So it could be both sets of fists they could tense. It could be both feet in their shoes. It could be both sets of glutes are a good one. Abs are a good one. Any sets of muscles on both sides of the body. So what I might do with my client is I might get them to do paired muscle relaxation with me using our fists. And again, we'll do it together. So what happens is I want them to hold the tension for at least 15 seconds. And then we're gonna use a cue or a word to just say, okay, and then release and repeat. So I'll show you what this looks like, okay? If I was sitting with a patient and they were overwhelmed, here's what I would do. I'd say, okay, Sally, I can see that, you're feeling overwhelmed. Let's take a minute. Let's do a skill together that will really help to settle your nervous system, and then we can talk some more. So what I want you to do is I want you to get your fists. I want you to tense them up as hard as you can for 15 seconds. And then when I say release, I want you to just release them, and we'll do that a few times together, okay? Just follow me. And I'll say, okay, get both of your fists and tense. And then I'll make sure I'm looking at a clock, because 15 seconds is actually really long. So I'm getting them to tense as much as they can for a full 15 seconds. And once we hit 15, I'll say release. I'll get them to shake it out. If you do this yourself, you'll feel what that does in the nervous system. You get this kind of rush of like feeling, and then repeat. So I might do that with my patient for just 1 minute, holding for 15, release and repeat. What that does, again, it's going to deactivate that amygdala. It's going to let them to settle down. It's going to get their frontal lobe back on. And then we can actually communicate about what's happening and how to solve whatever problem is going on for them. So that's a really great one for people who also struggle with agitation. It feels really good. So the clients I have that struggle with anger, frustration, agitation, restlessness, they love this skill because it just feels really good for them to tense those muscles and release. Again, once your patient has learnt this skill with you in a session, they can take this home and practice it and use it on the regular, and they should, right? It's a really great way for them to, again, have a really portable skill that they can use anytime they're feeling overwhelmed. And practice makes perfect with this one as well. The more they practice it, the better it will work. Now, we have a little saying in my clinic: the skills have worked if you got through without making things worse. Hooray. Now, this is really important to understand because this can be a barrier for patients when we teach them these skills. And let me explain that to you. When I teach these skills to my clients, there's a couple of responses that I often get. So I might teach them the skills in the session. They go away, they practice them, they come back next time, and I say, how did you go? Did you practice some skills, since our last session? And they'll say, yeah, I did the skills, Alex, but they didn't work. And I'll say, what do you mean they didn't work? And they'll say, well, I didn't feel better. Okay, so what do you mean you didn't feel better? Well, I didn't feel instantly relaxed. I still was feeling upset a little bit. Okay, so that's normal. These skills are not designed to take you from a 5 out of 5 distress to 0, okay? If a skill did that, it would just be an avoidance strategy. And we're not trying to give our clients avoidance strategies. We're trying to give them skills to help them ride out difficult times without making things worse. But we actually need our patients to get used to feeling some distress so that they can build their confidence that they can handle distress, right? There's a lot of things that humans do to get rid of distress that become problematic, like drinking, drugs, self-harm, suicide. These are all behaviors that will take people from a 5 to a 0. They'll get rid of distress really fast. The problem is they make people less resilient down the track, not to mention there are some negative effects from those behaviors. So if any skill immediately gets rid of distress, it could be problematic. All we're trying to do is give our patients a skill to take them from like a 5 to a 3. We're just trying to get that frontal lobe back on so they can access all that good rational thinking, they can problem solve, they can communicate, and then figure out what to do, right? There's probably still going to be problems that need to be solved after they do a skill. Okay, so if a patient says to you, well, I didn't feel immediately better, my response is, well, did you make things worse? No. Great, then it worked. Well done. Right? Because making it worse is doing things like ranting and raving, screaming at people, throwing things, self-harming. All of this makes things worse. Ending up in hospital for some people is making it worse. So depending on the patient, if they don't make it worse, and if they're able to ride out that wave of distress, then the skills have worked. Wonderful. So that's what we want to validate, right? That it's not about eliminating distress. It's about just taking the edge off so we can think our way through the problem later on. Another common problem you might encounter: what if I say to my patient, hey, let's try this skill together. I can see you're overwhelmed. And they say, I don't wanna, right? This happens sometimes. And that's okay. Some of the things I might say is, I might say something really validating and compassionate, but along the lines of, I'd really like to help you use some skills to calm your nervous system down. Then we can figure out how to solve the problem. We're definitely going to come back to that. If you don't want to try the skills, that's okay, but then I might have to get crisis services involved, and I don't really want to do that. It's not much fun. Would you be willing just to try? Sometimes if we present the alternative, like if I have someone in my clinic who's really like out of control, and if I don't get them to settle down, I'm either going to have to ask them to leave, or I'm going to have to call security or something like that. Not a great outcome. Or the police to take them to hospital. I mean, all sorts of things can happen. I don't want to do any of that. but I will if I don't have a choice, right? So if you have a patient in front of you who is way too escalated and risky, your next option is crisis involvement, right? So we'd like to avoid that where possible and actually deal with the problem, but the client needs to understand that if they're not willing to like accept some help with this right now, we might have to go down that route. I find often, even though they're in that overwhelm and they're not hearing you very much, most people can understand that they don't want police or security or an ambulance involved, right? So if you say, just humor me, let's just try it together for a minute, just give me a minute, right? We just want them to try. And then you buy that minute, things start to settle down. And it's a lot of that, just buying little minutes until we can figure out how to solve the problem. And once they've done that, they will be much, much more likely to use those skills again in the future. But you might have to have a plan B. You always got to have a plan B. You'd rather not use it, but it might be there. And look, your plan B might be what you're doing at the moment anyways. So the skills just give you another option for a plan A. So here are just some practical things that you'll probably need. So as I said, towels, right? Get some towels. Kmart, cheap as chips. I buy like the little face towelettes, but hand towels are great as well. So we have a whole stack. We have, dry ones. We have ones that then we wet and put in the fridge. We keep those cold compresses in the fridge. So those small freezer gel packs are amazing. Or a sink or a large bowl to fill with cold tap water, whatever works for you in your clinic. As I mentioned, bubbles, like little pots of like bubbles with bubble wands, especially if you work with kids who might be distressed or teenagers, that can be a great thing to get out and say, you know what, let's just blow some bubbles together. I know this sounds crazy, but I've heard this really works when you're feeling overwhelmed. Let's try it together, right? So get two lots of bubbles, or maybe get 10. You want a clock? I mean, you probably have this already, but you want something to be able to time if you're doing a skill with a client. Say you're doing the tense and release skill. You want a clock that you can see that can time you for 15 seconds. And then to know, if you're going to do a skill for a minute or two, how long that is. You want to have a list of these skills nearby. So you can obviously take the handouts from this webinar and, take one of those pages and put them on your wall. If that's easy, or you can write them down. But you want them nearby so that you don't have to remember and they're right there. Okay. And if you try one skill and you feel like it hasn't worked very well, try another one. Yeah, sometimes people respond better to one than the other, although the dive skill will always work. So I would always use that one if you can. You want to train your team and colleagues, right? Because again, if I have a patient in front of me and I've been with them for 15 minutes and they've just started to escalate, it's really great to have a colleague who I can bring in to say, hey, how about you guys go and sit out in the waiting room and, just do a little paced breathing skill together, or come and sit over here and so is going to help you. Sometimes it just helps to have other people who can also step in and who know the skills really well. So if you work like in a GP practice or a medical clinic, admin staff need to know these skills. I just did a little bit of a tour around the GP clinics in my area this week, touching base with the admin team and taking little packages of, cold compresses and towels and things like that and tip skills around, because often admin are dealing with the highly distressed patients as well. So your admin team should know how to do these skills, make their job a lot easier. If you want someone to come in and train your team, I am available if you're on the Central Coast. I'd be really happy to come out in a lunch break or something like that and just train your team into how to do these skills, admin team and clinical team. And the best thing you can do is to practice these skills yourself. So try the dive skill and see what it feels like. Try the tense and release, try the paced breathing. When you try them, you'll notice how that feels and what happens. You'll be in a much better position to help your patients use them. And if you ever hit overwhelm, which let's be real, we're humans, we all get there sometimes, you have these skills up your sleeve too, which is wonderful. All right. Before I take questions, I'll just let you know about some things we've got coming up at my clinic. We've got a couple of workshops coming up. This first one, Managing Risky Clients, the Essential Toolkit. So this is just a one-day workshop I'm running at Erina. I'll be going through these tip skills, but I'll be going through in a lot more detail a whole bunch of other skills that we use with managing our complex and risky clients in the practice. So when I say risky, I mean clients that, engage in behaviors like self-harm and things like that. I'll be talking about effective safety planning, which is different to how we're often taught to safety plan. And I'll be talking about all the other ways that we can support those risky clients so that we feel super confident when they present. And we don't automatically have to always refer them to the emergency department. It's great when we can avoid that. The other thing we've got coming up is a series of workshops for parents. If you work with kids, teenagers, or parents, if you come across a parent who has a teen who is self-harming, I'm running, it's a series of 3 evening workshops over June and July for parents who are worried about their teen's self-harm. And we're going to be covering the skills I covered tonight, plus more. We're going to be talking about effective validation, safety planning, and again, just trying to get them really confident and skilled up around how to manage self-harm in a really safe and effective way that's actually going to improve their relationship with their young person. So that's super exciting. If you know of any parents who might be interested in that, please let them know. All of these things are on my website, mindfulrecovery.com.au. The link is down there. Please feel free to check it out. You can also reach out to me there. You can send me a message or an email or whatever you like if you do have any questions about the content that we covered tonight. All right, so I'm going to turn off the recording now. I'll see if anybody who's on live has any questions. But those of you who are watching the recording, thank you so much for joining me. I hope these tools and skills have been helpful. And please reach out if you'd like to talk more about how to support clients in distress. Okay, thank you. Hi there, Sue. You're welcome. Do you have any questions for me tonight? Thank you for jumping on live.
No, not really.
Okay, perfect.
Yeah.
If you do, I'll send you the recording and I'll send you the link to the handouts. If you do have questions, please feel free to reach out to me.
Do you conduct a group PT for teens?
Yes, yeah, we run group DBT. Yep.
Is it specifically for teenagers?
Yes, so we'll take anybody from 13 and over. We have 2 options. We have a 12-week group or we have a 12-month group. The 12-month is very intensive, or we have a shorter version, which is the 12 weeks. And yeah, anybody 13 years and over.
Okay. How do you charge for it? How do you charge for it?
Yeah, so we're a private practice, so it's just private fees. You can get some Medicare rebates if you have a GP referral. For the 12-week group, for example, it's $125 a week, but you can get back about $32 a week for 10 of those weeks. So you get back a bit over $300 out of it ends up about $1,500 for the 12 weeks. The 12-month is more, that's closer to about $900 a month because you get all the groups plus one-on-one appointments plus phone coaching contact between sessions. So that's at a higher price point. You can still get those group rebates of about $300 for those. But yes, we do also take NDIS, self or plan managed people. That sometimes they have funding to pay for them as well, but otherwise we just do a monthly or a weekly payment plan.
Okay. Got it. Thank you.
No problem.
Thank you, Alex.
Thank you so much. See you later.
All right. See
Bye.
you. Bye. Bye-bye.